Your Excellency, the President of the Republic of Zambia, who is also the global cholera champion and also a champion, fellow cabinet ministers, the Secretary to the Cabinet, permanent secretaries present, the UN representative, WHO country representative, UNICEF country representative, JICA representative, US CDC representative, Africa CDC representative, may I simply say representative from other governments. I want to also recognize the ambassador to the US government who is here with us, senior government officials present, distinguished dignitaries, fellow members from the Ministry of Health, health workers and volunteers, members of the press, ladies and gentlemen. Allow me, Your Excellency, to welcome you back to the Heroes Cholera Treatment Center, which you last visited on the 10th of January 2024. Your Excellency, firstly, let me acknowledge your leadership, which has directed your government to remain devoted and resolute to the health and well-being of our people. This has led to actively addressing the current cholera outbreak and indeed other public health threats in the country. We can attest to the fact that your government's top priority has been the swift resolution of this public health crisis and the protection of our residents. Secondly, allow me to congratulate you at your appointment recently as the SADC Regional Cholera Champion. As Zambians, you continue making us proud, especially that this follows your role that you have played as the Global Cholera Control Champion, an appointment you received in May 22. We want to pledge to support you in making you and our country succeed so that we can be a pillar of hope to our people, the region, and the globe in reducing the sufferings brought about by this dehumanizing disease. Your Excellency, since the 18th of October 2023, when 2 cholera cases were reported in Kanyama constituency in Lusaka district, we have experienced an unfortunate surge in cholera cases affecting 70 districts of Zambia. This has posed a significant threat to the health of our people. This has been driven by the effect of climate change and indeed other social and environmental determinants. Specifically, Your Excellency, natural disasters such as storms, which have increased in frequency with accompanying flash floods, have increased the chances of water contamination with subsequent increased transmission and hence outbreaks of diarrheal diseases like cholera. These floods have spread sewage into boreholes, natural water bodies, wells, and washed away pipelines and sanitation infrastructure. Further, the prolonged droughts and warmer weathers due to climate change have allowed for several carriers of pathogens, germs, to remain active for longer periods, and this has created room for disease spread. Your Excellency, since this current outbreak, we have recorded 17,169 cases countrywide, with 622 deaths. 60% of these deaths, Your Excellency, have been happening in communities, and people have been brought in dead, what we call BIDs. Majority of those who died in our facilities are also people who did not report early enough to our facilities and died within minutes of admission. To mitigate this, we set up oral rehydration points in the communities so that our people with symptoms suggestive of cholera can be rehydrated before reaching the treatment centers. Further, we appealed to various transporters to provide transport to the people suffering to the facilities for earlier treatment. We also scaled up the treatment centers with increased bed capacity and improved skilled staff. We further engaged Gavi, the Vaccine Alliance, and through the UN systems, we received about 1.7 million oral cholera vaccine doses, which we have so far vaccinated our people. I'm pleased to report to you, sir, that approximately 1,888,112 individuals have been vaccinated in our hotspot areas. We have further vaccinated a total of 3,793 healthcare workers, including our volunteers, and 3,634 people in correctional facilities. All in all, Your Excellency, I'm pleased to tell you that 99% have so far been vaccinated of the targeted populations in our hotspots. Your Excellency, we are able to appreciate that our joint work is showing improved results. Our admissions have reduced from the peak of 1,187 a day in the second week of January this year to now under 200 admissions a day. Similarly, our daily recorded deaths have reduced from the peak of above 20 persons per day in the second week of January to now under 5 deaths. Your Excellency, together we have shown that even those who are suffering from a stigmatized disease can have dignified treatment, can have dignified meals, and indeed can have dignified beddings. We have been on the ground spending sleepless nights attending to our children, mothers, and young men, and we are proud of what we have done together under your leadership. Your Excellency, in the last 24 hours, we have recorded a total of 197 cholera cases countrywide. These cases were recorded as 134 in Lusaka Province, 29 in Central Province, 16 in Copperbelt Province, 12 in Southern Province, and 5 in Eastern Province, and 1 in Northwestern Province. Western Province, Luapula Province, Northern Province, and Muchinga Provinces have not recorded any case. Your Excellency, at this point, let me tell you that, in fact, a number of these cases in the other provinces were all coming from Lusaka by visitors visiting from there or Lusaka people going to those provinces. And so Lusaka Province, and in particular Lusaka District, and in particular the hotspots within Lusaka District were the drivers of this cholera. Lusaka District, which has been the epicenter, reported 134 cases out of the 197 cases reported in the last 24 hours. Specifically, these were 37 from Kanyama constituency, 29 from Matero constituency, 16 from Monali constituency, 8 from Chawama constituency, and 8 from Mandevo constituency, and 7 from Kabwata constituency. The other districts in Lusaka Province reported 25, Chilanga District, 3 in Kafue District, Chongwe District, Lufunsa District, and Luangwa have not reported any case. Your Excellency, we opened our largest treatment center here at Heroes National Stadium on the 5th of January 2025. This center received the first patients within few hours of us setting up this center after Cabinet approved that we open the center. And I'm glad to inform you, Excellency, that this center has moved from strength to strength. We managed to assemble community-based volunteers, environmental health workers, nutritionists, biomedical scientists or technologists, pharmacists, laboratory nurses, clinical care officers, medical associates, doctors, all health workers within few hours On January 10th, when you visited us here, we had exactly 919 patients in admission. Today, as of 6 hours, we've had 112 patients admitted here. By the time you were here, Your Excellency, the number had reduced further to barely 65 patients. After we had discharged some patients, and as I speak now, we only have 65 patients in admission, with 31 children and 34 adults. We have referred 5 patients to Levy Treatment Center. As you recall, Your Excellency, we were the main referral center for cholera cases, but every time we had a case of a double disease, cholera and maybe any other non- or communicable disease, we then referred such patients to Levy for further treatment. So in the last 24 hours, we've referred 5 patients to Levy Treatment Center. We have not recorded any deaths at this facility for the past 10 days, Your Excellency. Your Excellency, all that I've spoken of in terms of the decreases, this is the progress we have made over the past 4 weeks of us managing these patients under your charge. Your Excellency, would not have managed to achieve these successes without the support of each and everyone in the community. We have received great support from our local partners and individuals. These include various banks and various business houses, various cooperating partners, various business partners, organizations, associations, and individuals. We have also received huge support from our various cooperating partners, from United Nations bodies such as WHO, UNICEF, the US government, Japanese government, Chinese government, the World Bank, Africa CDC, MSF, and several other bodies and agencies, just too numerous for me to enlist. Your leadership, Your Excellency, has also been something we appreciate. The resources that you allocated to us from government made it possible for us to be able to set up this place within 24 hours. I want to thank you, Your Excellency, and the government of the Republic of Zambia for the support that you've rendered to the Ministry of Health and also to the various sector ministries that we worked together under the charge of our honor, the Vice President of the Republic of Zambia, Madam Nalumangu. Your Excellency, we now added another pillar of getting to the community to help move the cleanup campaign together with our counterparts from Ministry of Local Government, Ministry of Water and Sanitation, Ministry of Community Development, and Ministry of Education. We are encouraged by the support we got from the community. We hope our people will maintain good hygiene practices. We are making sure that our markets, our drinking places, our restaurants, our schools, and indeed our general public places are kept clean. This is a war that we have to win, Your Excellency, under your guidance. Your Excellency, I would go on and on. I want to stop here and say we welcome you once more to this center and we seek your counsel. Thank you and God bless you. I had said the U.S. British High Commissioner, it's not the U.S. Ambassador, it's the British High Commissioner. Sorry about that. Thank you. It is now my singular honor, privilege, and I'm very excited today with His Excellency being present, with all the partners being with us today, and seeing the numbers having reduced. I'm very excited to call upon His Excellency to deliver his statement. Your Excellency, sir.
Thank you very much. Minister of Health, thank you very much. Before I go far, I would like us to observe a minute of silence to give respect. You may take your headgear, please, off, to give respect to the late President Hage Geingob, President of the Republic of Namibia, who passed on a number of hours ago in the previous night. And we need, given who he is, distinguished freedom fighter, Namibia, as the young ones may not know, it used to be called Southwest Africa. It was under the South Africa apartheid regime following the German colonization, then apartheid South Africa. And President Geingob and his colleagues, Sam Nyoma, Hifikepunye Pohamba, and many others fought for their country's liberation. And he left us last night. A minute of silence, please. Thank you very much. May his soul rest in peace, eternal peace. Truly for some of us, as we were inducted in the presidents of our country, but to be part of the SADC region, he was there to help us settle down. And for the young ones, some of us, when we were going through as undergraduate students at the University of Zambia, he was a staff member of the University of Zambia professional staff because he was director of the Namibia Institute for many years. I went there his first year, I left his fourth year, I left him there. Never knew that he and I would serve at the same time, him as president of Namibia and ourselves as your servant here. Just to remind the young ones, the University of Zambia has produced a lot of leaders in this region. One time we had a meeting in Botswana, 4 of us, President of Botswana, President of Namibia, President of Zimbabwe, and myself. And it happened that 3 of us at that meeting, presidents, were products of the University of Zambia. Great contribution this country has made to the skills development in this region. As I said, may his soul rest in peace. We'll be mourning with the Namibians, all of us Zambians. Me acknowledge Honorable Minister of Health, fellow cabinet colleagues that are here. Me recognize permanent secretaries that are here. Me recognize their excellencies, high commissioners, ambassadors accredited to Zambia from different countries that are present here, our cooperating partners, the UN system, all of you in your diversity, you're well recognized, and indeed the business community that have been working with us in reining in on this terrible, terrible disease, embarrassing disease, I must say. And I must also acknowledge the medical staff, those that are in full-time employment, those that are volunteers. We recognize you for the work, tremendous work that you've been doing here. Members of the press, colleagues. The Minister of Health has touched on a number of matters. I wish to just pick a few issues or additions. First, I'm very grateful that I'm here once again at this center and having gone round this center and listening to the people on the ground in the different wards, I'm really, really encouraged by the progress that we have made as a country in reining in, bringing under control this disease. So thank you to all the workers, all those who have contributed to this success. You did get the numbers from the minister. No need for me to repeat that. The statistics are very clear. We mobilized as one team, one government team, the MMU leading the charge, so to say, Vice President's office, but all of the sector ministries, departments, partners, all of them honed in as one team. And I was saying to young people in there that this is the way countries should work, communities should work. We achieve more as a team. You want to go far? You move with people. You move with others of diversity. You want to dash and reach a shorter distance, and only a shorter distance, go alone. Go alone. If you faint on the way, you are dead. But if you go as a team, if you faint, someone will lift you up. So once more, thank you very much. At this stage, I must also express our appreciation, to reiterate what the Minister said, to all the support that we have received. Professionals, government, public sector, citizens who were paid for over 90% so far of the cost of this fight. But, as has been said already, the cooperating partners, their excellencies representing their home countries, please pass our warm appreciation to your headquarters. Please pass our warm appreciation to your headquarters. And to the UN representation, please pass the same message to all our global family members, all of them, Africa CDC, UN system, UNICEF, of course, included in there, all of them, British, Japanese, Americans, Chinese, Kaufela, all of them. Thank you very much. This fight is not about bringing the cholera pandemic under control only. This is only a tip of the iceberg. I'm glad to hear that when we set out to work as a team, one of the deliverables was to bring this disease under control within 6 weeks, significantly. We are in the 5th week, and it means we are within reach to bring this disease outbreak under control within our target of 6 weeks. I think we must congratulate the teams that are on the ground. But the point I'm making here, to reinforce what the Minister said, is that this is only a tip of the iceberg. We should not allow cholera to become an annual ceremony. We should bring cholera under control. We should eradicate cholera. So we have these short-term measures. We also have medium-term measures. We have long-term measures. All of these must be put together in a rational way, in a deliberate way, in a prudent way. I was checking outside there when I was told of the things we bought, that thing, and I said to somebody, I said, I hope you haven't paid twice the price. We must pay the right price. The quality must be acceptable, number 2. 3, delivery of the product or services that we buy to save lives must always be there. We don't want to use this situation to buy air and pay for air. We don't have money to pay for air. We want to pay for services and goods that are delivered. So we shall be prudent, we shall be optimal in all that we do as we fight to eradicate cholera in our country. And I'll mention elsewhere as well. So the work continues. The work continues and should continue in a methodical way. And at this point, I want to return to the work of all the medical staff deliberately, because we need them to continue doing this work. And as we know, I will touch on this just now, that it's not just medical staff, it's the whole society. It's a mobilization, it's a war, some kind of war. But to send a message to those who are in harm's way, as the Americans will say, frontline, taking risks. I'm told one of the medical staff passed on in the line of duty, someone who worked in the Chilenge clinic. But we lost many lives. It doesn't mean the life of the medical staff is more important than the lives we have lost, the 600 plus. No. Life is life. But some people choose to stand in the way of danger when others scamper. I know this from politics. During our difficult times, others couldn't even see me. Just to come and visit me in Mukobeko, they were scared they may be thrown in there. So some people run away, others fight. So to all the volunteers without exception, different categories. I know in the ministry we recruit health workers every year. Thank you very much. Thank you very much. I understand the young people's feelings. I understand it. But I'm saying we have a program of recruiting Minister of Health and other ministries. We have a program of recruiting health workers since we took public office 2 years, 5 months ago, in an organized way. I know Zambia got used to disorder, but we must be organized. And when we came in here, Minister, I didn't like the rush that was there. We must always be orderly. When we're orderly, we do things properly. So since we took office in an orderly way, we have been making sure that we bring in the patient to medical staff ratio down by employing more medical staff, dedicated staff, as we're doing for teachers. As we're doing for teachers, as we're doing for agriculture workers, as we're doing elsewhere. Yeah, I understand. So, let me... So, within Minister of Health and other colleagues' ministries, because some of the general workers category here can be absorbed elsewhere, right? So within the orderliness that we have exhibited since we took public office, within the budgetary constraints, and to couple that with natural attrition, because every organization, people exit, sometimes we lose them by way of death, some resign, some retire. By these measures, the combination of these measures, I'm directing that all the volunteers should be given permanent employment. Thank you very much. 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 Okay, let's move on. We have a lot of other work to do. Okay, I was saying that we have a lot of other work to do. Patients are waiting for you volunteers inside the wards. All right. All right. So, colleagues, Minister of Health, other ministers, DMMU, all of us, can we ensure that the database of volunteers is not adulterated? So let's be orderly. We know the list, and I mean not people working in this center. I mean those working volunteers in the centers, Cholera Centres across the country. Okay. Thank you very much. Let us move on. Thank you. Thank you, guys. Thank you. Thank you. I'll be done just now. I'll be done just now. So I want to repeat. I shall repeat. This will be done in an organized way. We don't want the list from tonight to start changing. If you change the list, ukaimwena we mwine ukuka papa. Okay. All right. Patients are waiting for us. Patients are waiting for us. Now let's move on. Let's move on. We have to bring cholera under control. We have to work to eliminate cholera. So amongst the measures we are putting in place, we will announce a full array of those measures, a matrix of actions. Can we manage our friends there? They will celebrate after we are done. There's time for everything. Now listen to the message, then you can celebrate afterwards. So, I was saying that as part of the coordinated program, we have worked, the teams have been working, Zambian teams, regional teams, CDC Africa, our partners, WHO, everybody. We've been working on what we termed as a matrix of actions that we need to put in place, which go beyond the Minister of Health. They go into local governments. They go into councils, local authorities. They go into, as I said, local government councils. They go into the Ministry of Infrastructure. They go in the Ministry of Education, Ministry of Health. They go in public places, markets. How can you have a market without water, without a toilet? Can you do away with cholera like that? Within a specified period of time, the President has directed that there will be no market which is operating without clean water and sanitation, including toilets. But this is only one amongst many other measures. So all of such measures, including Minister of Local Government, no more different views or opinions. This is not an opinion, this is an instruction. There will be no new settlements that are coming up which are not planned properly. None. Across the country. Planning permission is required to build anything in this country. And we have public buildings, such as a police station in Chawama, built on top of the water line. I have directed that police station this coming week must be pulled down. We tried to look at a solution where we could basically bypass the pipe. It's technically difficult. So the option is to pull down that police station. I hear there's another. If we are going to do that for public buildings, we will do it for private buildings as well. We need law and order. We need to follow guidelines. That's why drainages are clogged up. That's why water lines, mains are, if you like, polluted. So please, citizens, I want to appeal to you. The governments before this government were politically shy to take the measures that are necessary to upgrade the unplanned settlements. This government believes that we have paid a higher price as a people. The loss of 600 people should not go in vain. The best way we remember them is to upgrade our unplanned settlements. The best way to remember them is not to start new settlements without basic minimum facilities. Otherwise, we'll be back at this later this year. I don't want to come back later this year. I have other things to do. We have other things to do together. We have to complete the debt restructuring. We shouldn't be having these routines of negative things year in, year out. So I'm looking to you, citizens of Zambia, to support this vision, to support this government to do the right thing. If a voter doesn't vote for HH in 2026 because HH helped to upgrade the settlement, to take water, to shut down shallow wells, to shut down pit latrines that are mixing with drinking water, then I don't know what you want to vote for. So I'm not concerned about that. I'm concerned about the people we've lost. But whatever we do, we will do it properly. We will do it together. We will do it with consultative processes put in place, including the church, market leaders, other community leaders, unions. And thank you to the unions who donated some cholera mitigation items in Chipata. I was watching the news last evening. That's the way we should work together. No one will be left behind. This will be a national agenda. It's a war we have to win. So I ask citizens, I call on the nation to unite as we embark on this journey to eradicate cholera permanently. Permanently. Together we must set an example to others that we can kick out cholera as a nation. But as you heard from Madam Masebo, this fellow speaking here was appointed cholera control champion globally in 2022. And 2 days ago, if I'm not mistaken, 2 days ago, on Friday, the SADC summit met and my fellow heads of state in the SADC region elected me to be the SADC regional cholera control champion as well. So I want to thank my colleagues for entrusting, for believing in us. But that appointment is not for me as a church. It's for the 20 million Zambians, all of you. We are the ones who have been appointed. So we must lead by example. We must start by bringing cholera under control and kick it out from Zambia. The English, British High Commissioners here, say the taste of the pudding is in the what? The English say the taste of the pudding is in the eating. If we want to claim that we can get rid of cholera in SADC, we should do it first here in Zambia, so we can go and say to the region that we have done it in Zambia. Can we do it in the region? So at this point, I want to read out a few of the decisions we made as heads of state on Friday to eradicate cholera in all our regions, Africa eventually, and the global community. The first one is that we as SADC, working together in unison, will develop and implement a multi-sectoral cholera response plan that encompasses natural disasters and climate change effects taken into account, that effect on cholera, re-emergence of such a disease, in this particular case, cholera, to effectively control this disease so it does not spread across our national boundaries. Because we do work in Zambia, no work is done in Malawi, it will happen in Malawi. As you know now, cholera is in Zambia, Malawi, Mozambique, South Africa, Eswatini, Congo DR, Tanzania, Zimbabwe. In countries elsewhere, numbers are even bigger. So we decided to work together. Number two, to strengthen regional collaboration on cross-border outbreak risk assessment and public health surveillance to enhance early detection and prevention of outbreak-prone diseases, cholera being one of them. Now we want to look at other diseases. Number three, to jointly plan and implement synchronized cross-border cholera vaccination campaigns. I hear some Zambians were walking away from vaccines. Do not do those things. Man. This is to save lives. Your life and the life of somebody next door to you. Please, let's take vaccines. These are scientifically proven. Don't listen to witchcraft in the compounds. Agriculture, so here is cholera. How? So, we are talking about vaccination campaigns as appropriate and mobilize vaccines for all our citizens. So, 4, to increase investment in the current cholera emergency response while maintaining long-term investments in our programs for a sustainable solution so that we avoid the recurrence of cholera crisis. Number 5, to develop and implement climate-resilient water, sanitation, and hygiene, which is in short called WASH, and disaster risk reduction programs to prevent future cholera outbreaks. We are together? Number 6, to accelerate local and regional manufacturing. This is very emotional to me because I've been talking about this since we assumed public office. So, to accelerate local and regional manufacturing of cholera vaccines, to scale up production and increase access to commodities, other requisites that are required in this fight to control cholera, and ensure that the supply chain rigidities are dealt with so that when the vaccines are needed, they will be available in any of our countries on time. The Japanese are here. They devised a supply chain mechanism called GIT, just in time. Many, many years. When we were students ourselves, we found this, instrument being used. So, yes, just in time is important. It presupposes that the manufacturing facilities are producing enough, and indeed the warehousing is sufficient, logistics are in place, so where the vaccine is needed, or PPPs, they will be available on time. Under cholera, we had to wait for the first world to vaccinate its own population before we had vaccines ourselves, and we lost people. Lessons learned. We are together. 7, to increase investment in wash infrastructure and provide efficient waste management, Minister of Local Government, waste management, garbage, IFICO. People throwing stuff in the drainages. The Americans' Millennium Challenge account helped us to build the Bombay drainage. And you, the citizens, are throwing all sorts of stuff in that drainage. we have to clean that drainage ourselves. We should not ask the Americans to come and clean it for us. We should clean it ourselves. Garbage, wastage. I heard you, Minister of Local Government, you're talking about plastics. That is true. We have to deal with all those things that are clogging our drainages. But we must open more drainages. In the opposition, I used to say that Lusaka, part of Lusaka sits on a limestone. The groundwater level is very close to the surface, and the limestone base does not help. One of the things we must do, and we used to say so, and we now come back to it, we must develop drainages that lead us to channeling this water into reservoirs such as dams, and then we can reuse this water in an efficient way. Drinking water or agricultural water. This is the time we must do those things together. I said waste management, drainages, sustainable supply of clean water. Very important. 8, to increase budget allocation towards washer programs in our countries, SADC countries. Lastly, number 9, not the least, to strengthen accountability tools for monitoring washer interventions. So, kulibeka something. You are buying something, DMMU, and you start adding something, well, you know the consequences. That goes for the Ministry of Health, notorious for overpricing. Notorious. ZAMSA, notorious for overpricing. Nchekeleko, kasamthing. And people are dying because of kasamthing. We should not tolerate that. I'm not abusing DMMU. I'm not abusing Ministry of Health. I'm not abusing ZAMSA. All the ministries, local government is no different. Agriculture is no different. Just to remind citizens, we've changed laws. In the last parliament, we changed 3 laws. These laws now will allow us to prosecute corruption in the Economic and Financial Crimes Court within 5 months. You have heard me. Within 5 months. Don't go that way. Don't go that way, please, fellow citizens. You can do something good without damaging the treasury and allowing people to die. Because you have not sunk a borehole, you have sunk 1 borehole instead of 5. Because 1 borehole, you are sinking it for 200,000 kwacha, when the borehole is only 25, 30,000 kwacha. You don't need to fear anybody. You must be responsible yourself. To say, this, if I do, it will lead to someone having no clean water and someone will die of cholera. Have a conscience. As citizens, have some conscience. We need to reconstruct this economy. It went downhill. We will do it together. We will do it as Zambia, we will do it as SADC. And we ask for your support. Thank you for your kind attention. Thank you very much.
Thank you very much, Your Excellence, for your statement, and we will not let you down. We shall continue working hard. We ourselves have agreed that this fight has just started. It is an opportunity for us to make changes. So we've come to the end, and we just want to thank you, Your Excellence, for your statement. So thank you, Your Excellency. We will do as you have said.
Observe a minute of silence for all the lives we have lost under cholera. It doesn't mean President Gengobo's life is more valuable than others, but let's recognize, let's appreciate just 1 minute those that left us because of this dreadful disease. 1 minute of silence. Thank you very much. Thank you.
Thank you. Thank you, Your Excellency. We've now come to the end of our program. And just to thank you once again, Your Excellency, for taking time to come and visit your patients as we move towards ending cholera. As you predicted, you gave us 6 weeks. We are in the fifth week, and we are alive to the fact that there are various factors that can spring up. And so we want, under your leadership, to continue ensuring that we continue the works that we're doing. So thank you. I also want to say thank you to our partners. Thank you very much for finding time to join us. And thank you, members of the press, and ladies and gentlemen. May God bless us all. Thank you. If you now can allow His Excellency